Hello guys, welcome to our new video. So in this video, we are going to talk about plasmapheresis. Plasmapheresis is an extracorporeal therapy that we use in patients to remove antibodies which can further lead to transplant rejection, or we also use this therapy in patients with SLE, lupus erythematosus and other antibody antigen reactions. So we will dive into this topic and we'll see what this therapy is all about. So let's begin. So the plasmapheresis is also known as therapeutic apheresis. So let's see the definition first. So therapeutic apheresis refers to a group of extracorporeal procedures. So it is not a single procedure, it is a group of procedures. So we will see what are different technologies on which these procedures have been differentiated further in the video. But let's first stick to the definition part, and it says therapeutic apheresis refers to a group of extracorporeal procedures in which blood separation technology is used to remove abnormal blood cells or plasma constituents. So in this, what we do, we separate what? We separate abnormal blood cells, or we separate plasma constituents from the blood. So this process of separation is known as apheresis, and since we are doing it for therapeutic purpose, so it is called as therapeutic apheresis. Now if we break down the term plasma apheresis, so what is plasma first? So plasma, what is plasma? Blood plasma is a yellowish liquid portion of blood. So this part is known as plasma, and apheresis, as we discussed earlier, it is a blood separation technology. So apheresis, the term apheresis is derived from the Greek word meaning to remove forcibly. So remove something is what we call pheresis. So what is the technical meaning here? That it is a technique by which a particular substance or component is removed from blood. So this is the meaning of plasma apheresis. So we are forcibly separating the plasma part from the blood. So this is the meaning of plasmapheresis. Now moving ahead, we have to know the fact that plasma is the water component of the blood. It contains various substances such as protein, antibody, electrolytes and toxins. So these are the constituents of the plasma. Now the water component is around 92%. Now we are talking about the plasma, and in plasma itself there is 92% what? Water. Then there is 7% protein. Now what is this protein part? So it contains albumin, it contains globulins and it contains fibrinogens. So albumin, what it do? It keeps the fluids, the osmotic balance inside the blood vessels. What is the function of globulins? So they includes antibody immunoglobulins that fight the infection, and fibrinogen, a critical factor for clotting. So these are also part of the plasma, but they are only 7%, and the rest are solutes. Solutes only comprises around 1% of the total fraction of plasma, and solute comprises of what? Electrolytes, hormones, nutrients, waste products. Electrolytes are sodium, potassium, calcium. Hormones, nutrients like glucose, lipid are also present, and waste products like CO2, urea. So these all are present in our plasma. So this is the composition of plasma. So we can broadly say the plasma major part is water, second major is protein, then we have solutes or other constituents. Now in plasmapheresis, a large quantity of plasma is removed from the patient. The removed plasma is then replaced by FFP, albumin solution or normal saline. So since here, if we are removing this plasma part from the blood, then we have to obviously replace it with something else. So for replacement, what we use? For replacement, we use FFP, that is fresh frozen plasma, albumin and sometimes NS. So we can say broadly, in plasmapheresis, a large quantity of plasma is removed from the patient. The removed plasma is replaced by FFP, albumin solution or normal saline. Now earlier while we were discussing the definition part, what we saw there, that therapeutic apheresis refers to a group of extracorporeal procedures in which blood separation technology is used to remove abnormal blood cell plasma constituents. So we are going to talk about this group. So it is not a single procedure, it is a group of procedure. So basically there will be many methods of doing this. So let's see what are those methods. So mainly broadly plasma type of plasmapheresis are two. First one is centrifugal plasmapheresis and second is membrane plasmapheresis. The most common that we do in our dialysis unit through plasma filter, it is under this particular category of membrane plasmapheresis. Centrifugal plasmapheresis is another technique which is mainly used in blood banks. So we will talk about the types of plasmapheresis in our second part. So hope you understood the basic definition of plasmapheresis, the components of plasma, and the replacement fluids that we generally give to the patient while we remove the plasma from the blood. So this was all about this video. In next video we will talk about the types of plasmapheresis. Thank you.